So the next technique I'm going to demonstrate is a distraction manipulation for the distraction grade 5 thrust for the talar crural joint.
You're from Delaware, it's manipulation.
So the first thing I'm going to do is I just want to assess motion at the ankle joint. So I just want to get my thumbs in the joint space, and I use my other fingers to kind of feel for rotation. And then I want to hold the foot parallel to the floor and just kind of move it back into dorsiflexion, and it feels pretty restricted on this side. So restriction can be caused by a number of things. It can be caused by tight muscles, a lack of joint space, or it can also be caused by loose bodies. So one way to differentiate that is to kind of bring them to the tightness, the area where they're tight, and kind of put some distraction on it to see if the joint space opens up. And I'm trying to distract, and I don't really feel the joint space opening up. If the joint space were to open up, then you might not want to do the manipulation because they already have motion at the joint, and it might be a loose body that's causing the restriction instead. So I'm just going to assess bilaterally to see if there's a difference on this side. A little more mobile. Alright, so we're going to work on this ankle. So have you lie on your back. As always, you want to get patient consent. So what I'm going to do is a grade 5 thrust on your ankle joint here. I'm going to kind of pull it and then just give it a quick jolt into extension to kind of open up the joint space and reset the talar crural, or the talus, and the mortise. Is that alright?
That sounds good. What's a mortise? I'm just kidding.
So before you perform the joint, you want to make sure, before you perform the thrust, you want to make sure you have their ligaments are intact. So you can do that by just a quick assessment, testing the calcaneofibular ligament and the ATF. Everything seems to be intact. There. So now, use your good thrust or manipulation grip. You're going to pull the foot into dorsiflexion. You're going to kind of take up that joint space, and then before you do the manipulation, you just want to make sure your patient's not feeling a bunch of tension at their hip. Because the leg is straight, it is possible that we could be pulling the hip too. So take them to the end, ask them, so you're feeling this at your hip or mostly in the ankle?
Mostly in the ankle.
Okay. Just going to pull back, and it's just a quick thrust. And then I'm going to have you sit up. Just going to reassess the joint space. And it feels got a little more motion there. And that's how you do a distraction thrust at the ankle.